Yeah, you're good, Audrey.
Okay, good afternoon and welcome to today's session of Business as Usual. I'm Audrey Russo. I'm the President and CEO of the Pittsburgh Technology Council, and I'm joined today by my co-host and our Vice President of Visibility, Jonathan Kirsting. So a few things about today's call. We can't do any of our work without our partners, and Huntington Bank has really stepped up to be a strong supporter of the work that we're doing now to make sure that the community is knitted tightly together. So if you don't know about Huntington, they have been very, very busy lately, and they have always been the largest SBA lender in southwestern Pennsylvania. So their team is providing tremendous support for the community and the work that they're doing. And we couldn't be more prouder, and it can't be more critical. I also want to thank the team at AT&T for their support for our public policy series, and more importantly, for the support that they provide to the broader community during this pandemic. This week, AT&T announced 3 months of free wireless service for frontline nurses and physicians nationwide on the FirstNet network that's built with AT&T in a public-private partnership with First Responder Network Authority, as well as an additional $10,000 that they've given to support 412 Food Rescue right here in Pittsburgh. So as a quick programming note, and for only next Monday, and next Monday only, we are going to move this call to 1 p.m. Why? Because we actually have Dr. Louis Falo, Chair of Dermatology at the University of Pittsburgh School of Medicine. He is one of the remarkable leaders working to develop a vaccine and breakthrough vaccine delivery system to literally help save the world. So I hope you will understand why we moved the program to accommodate his schedule. And the next day we're back to noon with Senator Bob Casey. So a little bit about the technology for those of you who have not been here before. We've muted your microphones, and I would ask that you keep your microphones on mute through the entire call. Some of us have a lot of background noise going on, and we want to ensure that you can hear our guests very clearly. So with that said, we want this call to be interactive. Take note of the chat box at the bottom of your desktop screen. If you have any questions for our guests, type your question in along with your name and company, and we'll hopefully get to you. This session is being recorded and archived. So very importantly, and lastly, is that this section of the chat box is not for advertising your products. It is just for questions. We are here to be part of the community and understand what is happening right at our footsteps. So this afternoon, we have very important leaders joining us from Highmark Health and the Allegheny Health Network. Now, David Holmberg, who actually oversees Highmark Health, was called away for Washington to have a conversation with some folks in Washington. But I can't say enough about their team and the remarkable team and leadership that we are going to have a chance to have a conversation with. These people, they have been so accessible. They are working round the clock. They have been in the front lines of so many things in our community. But what they're facing right now is probably like no other. So as we work to help our member companies navigate the toughest of situations, sometimes even life and death situations, we are so fortunate to have a community-based organization with local leaders at the helm. So in Pittsburgh, we take that for granted. At least I think we often do. But not every city can boast of having this type of access to key healthcare decision makers like we do. And this team has always made themselves available to us and the entire tech community. So with that, I'm going to introduce two people really quickly, and that's Cynthia Hundorfean, who serves as the President and CEO of Allegheny Health Network, and Dr. Donald Whiting. He's President of Allegheny Clinic and the Chair of Neurosurgery at AHN. So on that note, I would like to bring Cindy to the forefront, and we're going to start with our program. Cindy.
Hi, Audrey.
Hi, how are you?
I'm good. How are you?
Hopefully everyone can see you right now. I'm going to begin. And as we work on our visuals, okay, there you are. So as we welcome you to the program, can you start out by providing us with a high-level overview how Highmark Health has responded to the current pandemic?
Yeah, I would be happy to. And first of all, I'd like to say thank you so much for having us on today. And as I said before, you're good friends to both Highmark Health and Allegheny Health Network, and it's a pleasure to be able to talk to you today. As you can all imagine, the last 4 weeks have been a blur. We don't know sometimes where one day starts and where another one stops. It puts a whole new meaning to working 24 hours a day, 7 days a week. But I will tell you that we're doing it with delight, actually, because we know that as we're doing that, we're protecting our caregivers and we're treating patients, and that's what we're all about. So we actually started our journey about 4 weeks ago actively. We started planning a couple of months ago, but it became real as the patients started to crop up in the United States. We were quickly connecting with our colleagues across the United States and other hospitals to find out how bad this really was and how they were treating the patients, and could we pick up anything that they were learning along the way that we needed to be prepared for. And several lessons came along very quickly. One was our personal protective equipment. We knew we had to jump all over that because people from every state were going to be needed, and we knew it was going to be in short supply. We were very concerned about our workers within Highmark Health as an organization. So we sent employees to work at home very quickly. And the vast majority of our workforce, I don't know what percent, but it's probably well over 90% of our employees are working from home at this point. We got them all set up. This all happened within a 3 or 4 day period. It was absolutely amazing. I've never seen anything like it. So there's really within the Highmark building, there's just a very, very small group of people, probably 20, 30 people tops that are working physically because we just need to be here right now. So as you know, there's no plan sitting on a shelf for dealing with the coronavirus. So everyone is learning as we go along. So we put a team together immediately that included our Highmark Health colleagues and people from across our system, the clinicians, nurses, the supply chain, I mean, you name it, they came together so that we could plan, put together a really good plan on how we were going to treat this going forward. The physicians had to put together protocols for how our patients were going to be treated once they arrived in our emergency departments. Our infectious disease doctors, as you can imagine, got very, very involved. We had to amp up what we were going to do in regards to testing, whether we could provide it, whether we needed to rely on other people to do it. So all this was going on simultaneously at the same time where we were trying to get all of our hospitals ready and get the caregivers ready to be able to accept these kind of patients, making sure that they were informed, that they knew what they needed to wear as far as masks, what they needed to do as far as gowns, what they needed to do as far as their hands, entering the facilities. We had to change our visitation policies. So everything needed to be changed, including how patients entered our emergency departments, because we knew right away that we didn't want patients coming into our EDs especially if they thought they had the coronavirus, because we didn't want our employees or other patients to be infected. So we set up mobile stations right outside of the emergency departments in all of our hospitals to be able to triage these patients as they came into our hospitals, and that was very, very helpful. We also set up drive-through collection stations to check patients and see if they have this. So we've been doing that, and I think we're averaging right now about 120 collections per day. One of the things that every time you do something like this, you think back of what would I do differently if I had to do it all over again. And the one thing that I would say that I'm glad that we did, that I would encourage other people to do in any situation like this, is we put together 2 teams of people. All of the hospital leadership talks to each other at 7 o'clock every morning, all of us together. There's probably 15, 20 people on the phone. We do what we call a roundtable. This was all set up by Joe Benedict, our chief operating officer, where every single hospital goes around and talks about, what they're experiencing, the patients that came in through the ED, the patients in the ICUs, where we are as far as testing and supplies, those kind of things. And we've learned a lot from each other. Then at 9 o'clock, we get on the phone with Highmark leadership so that we can talk to them about what's going on and where we're short on things so they can jump in and help us out. That has been I think, so well regarded by everybody, because all of the leaders who are actually pushing this work forward are so well informed that they feel more comfortable, even though this is not a good thing to be going through. They at least feel like they're very well informed. They've got a place to turn to if they do have questions. We set up a pandemic room, operations room in the boardroom on our floor at Highmark that actually shows real time the status of all of our hospitals, the beds, the patients, where they are in testing, the positives, and unfortunately even the deaths. And that tells us at a glance where we need to move patients, what we need to do as far as getting additional equipment and supplies, because that's all live on our boards too. So that has been very useful. And keep in mind, I mean, this has all been done over a 4-week period. None of this existed 4 weeks ago. And it's not just us, because I can tell you that other healthcare systems across the United States are doing exactly the same thing. We were just fortunate that we had really good partners to be able to rely on and say, we need help with this, and they were ready to jump in and help us. So Don, I think, wants to talk to you more. We've talked about telehealth a little bit, but he won't really get into what we did with our physicians and our patients.
So even before the pandemic, Highmark and AHN were moving to adopt telemedicine as a new form of healthcare delivery. Talk about how it's been accelerated since the pandemic. And do you think that it actually might lead to broader long-term adoption, particularly for patients even in rural communities as well as urban?
Sure, Audrey, I can take that.
Okay, thank you, Dr. Whiting.
Thank you, and thank you for inviting us. So I think what Cindy was saying about how we had really gotten integrated with Highmark as part of what we were doing originally, all of that stuff got supercharged. We started having regular data meetings. People on the insurance side who normally would be doing a different job figured out how they could help us do things that were relevant to us on AHN to acquire supplies, or some of their customers maybe had assets that we could use, things like that. So that's where the telehealth kind of really took off as well. So again, the key to the pandemic is social distancing. So immediately we had to stop seeing patients in the offices, but we had to still take care of people. So what we did internally, with some help from Highmark Health as well, is to get about 2,500 providers trained up within about 4 days and outfitted with all they needed to have to start doing telehealth. So in about 4 days, we had pretty much all of our clinics and all of our outpatient settings set up with telehealth, which is amazing. And it ramped up gradually, but we're now at about 3,500 to 4,000 visits a day on the telehealth platform, or platform similar with phone platform and things like that. So to get to nearly 20,000 non-in-person visits a week in a matter of a few weeks is nothing short of amazing. And it took the entire enterprise to do that. To put that in perspective, that marries up very similarly to what Cleveland Clinic's doing on a weekly basis and other organizations. And this wasn't even something that was in place previously. So, it was a necessity because of the pandemic, which added the urgency. Our entire enterprise contributed resources to make it work efficiently and very effectively. The insurance side also helped out with, insurance coverage and things like that to make things where patients didn't have to worry about it. They just get on the phone and have a visit. They didn't have to worry about paying for things or any other things you worry about. But what we learned from it was that a lot of people really like that type of interaction, both on the provider side and on the patient side, because it allows people, particularly younger people, but actually surprisingly, a lot of older people as well, they don't necessarily want to get out in the world if they don't need to, and particularly now, but even it's an effort to get to a doctor's office for older people, and they have to bring family and things like that. We can provide nearly the same level of care through televisits right now, and as we add, part of our journey before all this was to add technology in the home, blood sugar, blood pressure, different things that can be monitored in the home, so we can get data, even using your iPhone or an Apple Watch for how much you move around and to track your daily activities and load that into your medical record. We were on a journey to do that already, and this kind of supercharged it, but it also, more importantly, had to gain acceptance really, really quickly. And that wouldn't happen in a non-disaster format, but we're going to be left with a significant number of people who like televisits. It'll help us consolidate our care and give better care, and in fact keep people healthier, because we can interact with them on a day-to-day basis more easily than having them to set up appointments and things like that where they have to drive into an office. So it really, it's been very well accepted. It's led to a lot of technological advancement very quickly, and it really sped up our journey by probably a couple of years.
So Jonathan, there are some tech-related questions, I think, in the chat room.
Yeah, they're just starting to bubble in. And I want to thank you guys again for taking the time to talk to us today and really salute the work that you guys have been doing. It's such a difference maker. So we have a question here that can talk, if you can talk about how you've needed to adapt protocols and communication related to patient experience, given the visitation restrictions and things like that. And are you leveraging a similar approach to telehealth, when communicating patient status with families?
So I can answer that briefly, and then Cindy can jump in. So a lot of the things the government have done have made it easy to roll this out quickly. So, right now you can use FaceTime and other things that previously wouldn't have been allowed because of HIPAA restrictions and things like that to connect to people. So that's gonna tighten up a little bit appropriately as we get out of the pandemic and more into a more regular situation. So the government has helped loosen a lot of restrictions that would have made this much harder to roll out quickly. But also, it also created new ways to interact with patients and their families. So, for example, right now, we have a visitor policy that really doesn't allow a lot of people, really anybody, to come in and visit a family member unless they're a minor or in other certain very specific circumstances. So a lot of people's family members are going through the diseases without having family in the room or visiting regularly. So we're working through our patient experience team to keep that communication open with FaceTime and providing iPads and things like that if they need them to really create that interaction as best we can without really creating a problem with spreading the disease. So there's been a lot of creative work going on. Some of it is going to get regulated again when this is over. So we'll just have to adapt technology around that, which is an opportunity for you all to look at ways to do that. But I think, loosening the restrictions as well as just creativity, because ideas are coming out of the woodwork from everybody, and we've had offers from others to help partner with us on that, and that is an example of the community and industry and nonprofits in the area really trying to help us do our job even better. And that patient communications one's a real example where we had outreach and connected with our patient experience team and people in the community to make that work out. Jonathan,
is there another?
Yes. They are coming in hot and steady right now. I love seeing the chat section bubble up here, that is for sure. So talk about some privacy concerns. What have more of those arisen with telehealth and interactive monitoring capabilities? Is legislation keeping up with this shift in modalities?
I would say privacy has kept up with it in that they have been flexible. That's one of the things that I think, have really enjoyed seeing, because we were worried about that. Because, as we jumped into telehealth in a big way, we were worried about HIPAA issues, family issues, all those kind of things. We were also worried about, as patients were in the hospitals, and we had family members visiting via iPad, those kind of things. Everything that we were doing before in regards to privacy kind of went out the window. It was a new day. And because there were so many relaxations from a government perspective, from a CMS perspective, it was very, very helpful. And I think ultimately good for the patients, good for the families, good for the physicians. So it's been interesting to see how fast actually the regulations were modified to be able to fit what's going on right now.
So let's talk a little bit about some of these partnerships. In a classic Pittsburgh fashion, your team pulled together, and actually stood up your own assembly line for test kits. Not only just hearing about that, but also companies like MSA, they have helped you to secure essential supplies.
They have MSA, Miss Sorrow. I mean, the list is endless. Well over 100 companies at this point, but they were two very, very special partners that just called and said, what can we do to help you? And I will also tell you that David Holmberg was absolutely key and critical during this whole time, because he was on the phone endlessly, calling people, and people that we would have never really thought of from a healthcare perspective, that wasn't really attached to healthcare, but they had connections to other people, or they could modify their operations to be able to help us out. And they really stepped up to the plate, and we have been so thankful for companies around Pittsburgh. I've never seen anything like it before. And we've been very thankful, very grateful, and we've let them know that we've been very grateful. And our caregivers, the fact that they can utilize this protective equipment to really, help get them out of harm's way. I mean, you can imagine how grateful they are. They're how grateful their families are, and they say it all the time. So we are really, we're really always pushing back to the people who've helped us out. This is what your work has really gone for. This is what it's doing. This is the benefit. And I think that they feel like they've been part of everything that's been going on with us.
Can I add just a little bit to that too? Just, I truly, I mean, you talk about, what's really amazing about this. It really is a wartime mentality, and the entire community has pulled together and volunteered any part of resources they have, talked about retooling factories, talked about donating equipment that they have, creative ways to interact with us. But there's been nobody who hasn't wanted to get to the answer to save the most patients in this area and keep the most people alive. So everything that you see us do is a result of the amazing community response of everybody just saying, like Cindy said, how can I help? Not, I can give you this for this or something like that. It's just, anything's on the table, how can I help?
So what did MSA actually do? Can you talk about that for a minute? Because that's a,
Sure.
a company.
Yeah, I'm sorry.
No, that's a company that's pretty active in the tech community, and I wanted just you to talk about that a little bit.
Sure, absolutely. MSA was really I think the first that David brought to us after talking with Nish, who I've never met, but I've texted back and forth with quite a bit now. But they had about 65,000 N95 masks, which are a hot commodity, a few weeks ago in another country, and made them available to us. So getting them to the area and then working with us to distribute them. And then we ended up distributing them fairly equitably among the hospitals in the region, because everybody was in need, as well as a lot of the first responders. So they kind of set the pace with that particular thing. But then also they have other gear for fire safety, and some of it had never been used in medical situations. And the elastomer masks, the rubberized masks that are reusable, essentially the equivalent of hundreds of N95s, because you can re-sterilize them every day. We started working with them, and they did some testing, and we did some testing together, and kind of found that these were safe and sustainable. And actually, these masks were N100 masks, which means 99.7% of all the air is filtered, whereas N95s, it's 95%. So it's even better, and it's reusable. So they were real collaborative with us and in testing it very quickly and looking at it using it in a care provider type of situation. So it's provided a situation where we're now less dependent on the N95s and give our caregivers much more safety, both actually and a feeling of safety because of the work they've done with us. But again, there's been hundreds of examples of that. Thread International making shields for our providers. We could name hundreds.
So cool.
More questions, Jonathan. You want to get some more questions?
Yeah, so Ken Siegel's got a bunch of questions here, and we can't get them all out, but I think the one that really kind of comes up to the top for me here is really like, I mean, how are you planning for the post-COVID surge in like ambulatory demand, and really how you're going to be operating in general, because this is going to be a whole new environment now, right?
Well, it will be a whole new environment. We're spending a lot of time, as you can imagine, on what we think it's going to look like after the fact. We know that telemedicine is here to stay. It's not going to be going backwards. So we'll incorporate that into the way that we work going forward for sure from an outpatient perspective. And that will be for both primary care and specialty care because, interestingly, the specialists are liking this as much as the primary care docs. Are liking it because they're able to have a different kind of visit with the patients and the patients seem more satisfied with it. It's all around a great thing for us to be able to do. We're spending a lot of time right now talking about our surgical volume because as you know, all hospitals postpone their elective surgeries. So that at some point will be coming back online and we're talking now about how and when we will do that. We have to be very careful. It has to be staged. We have to make sure that the proper testing is done not only for the patients, but for the caregivers that are going to be around the patients that will be coming in. And keep in mind, remember, the ambulatory surgery centers are now closed throughout the state. So at some point, those will need to be reopened. And healthcare facilities will be trying to determine what's going to go where at that point, depending on how patients are testing and how their employees are testing. So it's not going to be back to business as usual anytime fast, that's for sure. But it'll be probably a slow, methodical build up in volume. And I don't know what date that's going to start, but it'll be in the near future, I'm sure.
Very cool. Audrey, we have a great question here as well from Todd Underwood. BK, can you bring Todd live so he can maybe ask the question? Todd, are you there for us? Just in case, I'll ask it for him. So Todd, is he there? Oh, okay. So Todd wants to know, so when are you forecasting the peak demand for ICU services in Western PA, and what do you think the new normal will look like this summer?
Well, Don, we could both answer, but I'll let Don answer it first.
So I think, I think an important thing to understand is that this region, a lot of the United States, this region in particular, was very good about social distancing. So the assumption is that there's about 3 or 4% of people who've been infected. That may not be accurate, but we don't have ubiquitous testing and won't in the near future to be able to test for antibodies or things like that. So you have to assume that 3 or 4% of the people have been infected. To get sort of a herd immunity, you have to get to about 60 to 65%. So we're preparing as we ramp back up for having a constant level of COVID activity in all of our hospitals as people get out more. And depending on the rate at which we sort of liberalize activity and bring the country back to normalcy in the new world, will determine how big those surges are. But we're putting on a background level of COVID activity with intermittent surges until we get to that 60% herd immunity or get a vaccine, which is probably a good year or more down the road, it seems like. So the fact is we're going to have this, it's a new normal for at least the next year as we prepare for potential surges, have people in the hospital that are being treated, and still get back to doing our regular business.
And Audrey, I would just add that in regards to the surge, there's 100 models out there nationally that people are looking at. We spend time every day working with our people on the surge because they're working with people from CMU and other places on the surge. And we've talked to our colleagues at other healthcare systems locally about what they think. And as try as you might to try to predict when it's going to happen, you can always be off. It's somewhat of a guess. The thing that I get worried about is that, if you looked at over the weekend volume of patients who were tested positive and deaths, it went down, swung down on Sunday, and it came skyrocketing back on Monday. Now, why did that happen? Who the heck knows? It was there on Friday, came down, and it went up by 80 deaths on Monday over what it was in the weekend. And there's no rhyme or reason that we know of. I mean, is it patients just not going to the hospitals? We just don't really know. So every day we learn more. The one thing I can tell you that is so different about what we're going through versus anything else is that when we learn something, we share it with everyone, and everybody's sharing it with us because everybody wants to find the answer. And if you know something that I don't know, then tell me so that we can all learn from it. And that's for sure been happening. But I get worried that people will relax too soon, because we still have a lot of patients in our hospitals that are positive or are awaiting their test results. I think we have about 240 patients in the hospitals that are just awaiting results that could turn positive. And a number of people in our ICU. So it's still a big issue for us right now.
Okay. So, in the days after 9/11, it's the only kind of catastrophe that in my lifetime I can go back to, the American public became keenly aware of the sacrifices made by our first responders. And now in COVID-19, you've already both have talked about how amazing your caregivers have been. That we have a deep, everyone wants to help, deep professionalism in terms of the work and sacrifice that everyone's doing. How is your team, how are those people keeping up?
They're
How
amazing.
Are they holding up?
They're amazing. They're incredible. I go to bed every night worrying about them. I wake up every morning worrying about them. And do you know what they do? They email us during the day asking how we are as a leadership team holding up. I mean, these are nurses on the front lines and our EDs saying, thank you for everything that you're doing for us to keep them safe. This is the people who are taking care of our families, the people that are taking care of us. They're absolutely incredible. They don't complain. They do their jobs with a smile, which is why we do everything humanly possible to get them what they need to be protected at all costs. But I couldn't be more proud to be working alongside every single one of my colleagues right now, honestly. Dawn, I'm sure you can add to that too. Same thing for the physicians.
Yeah, so like Cindy said, they're amazing, and they seem to show no limit, but we also have a wellness program built around this, and there is, like 9/11, there's going to be some PTSD with some of the things that they've had to deal with, and we're preparing to address that, because really our number one concern is our patients and our caregivers, to make sure that we keep them all as maximally healthy and as we can.
So we've heard anecdotally that with everyone being home and spending more time on projects around the house, and perhaps having more time for people to ride bikes and taking on some new things that we've never, standing on ladders, et cetera, that the ERs are actually experiencing an influx of non-COVID-19 related injuries. Have you seen that here? And can you tell us what has surprised you from the perspective of the front lines?
So I'll take that and you can jump
ahead.
in. What we actually saw was a lot of the emergency department visits that we would see, even for chest pain and things like that, went down. A lot of the visits just went down. And I think it is partly because people are getting more rest. They're doing things to stay healthier, and they aren't pushing themselves as much as they would trying to sort of be in the 60-hour-a-week work week or whatever. But just in the past couple of days, there has been some increase in just what you said. And I think it's because people are starting to feel comfortable that they don't have to be holed up, and they're getting out more and trying to do more, because they're starting to get a little relaxed about this whole thing. And we're starting to see the beginning of the trend back up. But like you said, athletic injuries, falling off of roofs and things like that, mixed in with the usual things like chest pain and other things.
Okay. All right, great. Are there Jonathan, any questions out there?
We got a bunch of questions, and I don't think we have enough time to get to all of them.
Okay, well, let's get to a few.
Couple quick ones here. So what successes are you seeing with the pharmacological treatments that look promising in the short term?
Well, Don can speak to that. We review those every day. We scour the literature. Well, there's so much information that's pushed to us from the American Hospital Association, from Hospital Association of Pennsylvania, from Allegheny County Board, as far as the new treatments that are coming out, plus our own researchers are doing that. I don't know, from a clinical perspective, I will have Don respond to that.
Sure. So Plaquenil, hydroxyquinolone, is a popular one that the president talks about and a lot of people talk about, and it's typically a rheumatologic drug. In India, they're using it prophylactically in their workers, but they haven't in their healthcare workers. But the big risk with it is arrhythmias, cardiac arrhythmias, and there isn't really any proven benefit. So we are looking at it in a sort of study format to evaluate how that works with people. The thing that we've been doing for some people, because part of the thing with COVID is the cytokine storm. You get a big sort of reaction that creates inflammation and makes your body fight itself. So we've been plasmapheresing, where we take off their, sort of clean out their blood of the cytokines, and then give them back their own blood. That's helped sort of stave things off. We're also starting a study with Blood Bank and with UPMC on taking recovered people from COVID and taking their plasma and putting it into sick people, looking at that. And then there's a number of other studies that we're starting and looking into, but there's just no good answer right now for a treatment other than preventive care and good oxygenation.
But I can tell you that even though I'm not a doctor, if you look at the literature that comes out every day about the new trials that are out there that got sped through, not going through your normal mechanisms that you would do in order to do clinical trials, but just because we need to find an answer, there's probably hundreds of them out there that are new that, at some point one of them is going to break, or two of them, or five of them, or 10 of them, and all of us can't wait for that to happen. But you see those out, and then you hear some of the comments from the people who are involved in those studies, talking about promising results already, but you have to take that with a grain of salt, because at some point it does have to go through all the proper mechanisms to make sure we're not going to be doing something that's unsafe for people across the United States. So we are going fast, but that being said, it's still going to take a while.
Mm-hmm.
Absolutely.
Any other question out there, Jonathan?
Yeah, so like I said, I just love having our audience is the smartest people out there, because they got some great questions, and it's so glad to get these in front of you guys to get some of the information out there. So are you looking at basically keeping the command center you guys have rolling? Is that going to be something that's going to stay on and keep on trucking, and something that's always going to be in the background in case something like this happens again?
Yes, the answer is yes, for sure we will. We'll keep that going. It's staffed with some of our nurses and physicians. Right now, some of our orthopedic surgeons, some of our hospital presidents and hospital administrators. We'll keep that going. It's been, I think, really good for them to be able to learn what's going on throughout the system, but even better for us because we can walk over and see exactly what's going on. And because it gives us the ability to have an eye on every single one of our beds throughout the system. I think going forward it'll be critical, especially as we begin to open up our ambulatory surgery centers and helping us navigate and move patients around the system. It'll help us in a lot of different ways. And because we have all of our inventory on this system too, we can see in a minute's notice what needs to be moved from there to here because somebody's going to run short within the next 24 hours or so. So yes.
What about increased testing? What are some plans for
good one.
testing?
Definitely.
Oh, the bane of my existence. So
yeah.
That has been a sore spot with everybody, not just with us. If you're lucky enough to be able to do your own testing, that's a really great thing, but very, very few hospitals are. And within the day or two, we will have some of the platforms to be able to do some of our own tests, I think up to around 200 a day. But we got a lot of irons in the fire to be able to increase that volume, as do other hospitals. They're all trying to do the same thing. When you rely on centers outside of your own system to be able to do that, it's the transport time and waiting for phone calls. It has really added to. It's a source of irritation, I will tell you. And we feel pain on behalf of our patients of just sitting at home and waiting. And you worry about who are they exposing while they're waiting. And then sometimes they get sicker and sicker. And that has been a real problem. So that has to be sped up.
Yeah. So I just add to that a little bit. So testing, with testing both for COVID, but also for antibodies, two separate types of testing, it would be ideal if we had those, then we could do that to anybody. we have internal testing for 2 platforms and adding a third one in a couple of weeks and getting them as quick as we can. But we still only have internal capacity to do about 50 tests a week. And that's usually for the people in the hospital. But to go out and test in situ, in location, in a nursing home or something like that, there just isn't enough. And one of the main tests, BioFire, the entire national supply was taken by the federal government. We were supposed to be getting some, gone. So the government has taken a lot of this that is available, probably likely to distribute to the hot spots, but it does make it hard to get to a way where you can start getting preventive and organized around it. It'll probably be another 6 months to a year to get to where we can do that ubiquitously, and by then we may have enough herd immunity to not necessarily need to do that.
So on the last note, since we were representing the tech community here, how can the tech community who feel like they have solutions, and you and I have talked about this even offline, how can we work with you when there really are solutions that are right at your footsteps?
I can give you my phone number. I can give you or our email. Here's the thing, and Audrey will attest to this. If you email or call us, we will email or call you right back.
They're amazing.
Always do that because, we would love to have your support. The last thing that we want to do is to be put in a situation like we've been in over the past several weeks where, we're waiting on people to help us. We want to be self-reliant, but we need other people to be able to help us do that. And we need really smart people to help us do that. I would love for people to reach out and say, okay, let's going forward, what could we do to help you figure this out? So please, if you have ideas or suggestions, just reach out.
Okay. So if there are we've taken a lot of your time. So I can't thank you enough for just being so candid with all of us and for being exemplary. I know that you're all working 24/7 and we really want to help. It's not just a vapid statement. There are people who feel like they have a lot of solutions that they can be helpful, and they want to be helpful on so many different dimensions. So it's our requirement to do that. We definitely want to make sure that you're getting all the tools that you need and the support. My hat's off to both of you, as well as David. I know David is in communicating with Washington right now, and he couldn't join us. But I know David professionally, and I know he wished he was with us. And he is clearly very excited to, become even more tightly webbed into the tech community. So I thank you so much. I want to tell everyone, you two can go back to work. Maybe this was a break for you.
Exactly.
Thank you, everyone. Thank you for taking the time. Really,
thank you so much. And as a close, I just want to thank AT&T and Highmark for the work that they're doing. And tomorrow, we're proud to be hosting Congressman Mike Doyle. So I'll see you then. And we have recorded this, so you can go out to PGH Tech and you can find every one of our discussions that we're having at noon, so that we can keep this community knitted tightly. Thank you both again. Stay safe.
You.
Good stuff, guys.
Thank you.
Appreciate it.
You too.
Thanks, guys. That was great.